Well, I wanted to go back to that idea about how veterans know that, and then PTSD, it's like nuances. Military veterans understand military veterans, and they notice them.
Mm-hmm.
Combat veterans notice combat veterans. PTSD veterans notice other people who have combat PTSD. It's
Not always.
but frequently
Yeah.
they will dial into it because that's how people show up in my office. They said
Right.
some guy came up and started talking
Oh,
to
people
me.
that have been in treatment.
That have been in treatment,
Yes, they recognize
that's
it.
exactly it.
Because we train them how to look for the signs.
How to look
Right.
for it, and then they will go to some maybe almost stranger and go, hey, what'd you do and what'd you do, and if they'd all bring it up, then they're that's sort of an in, and they go, there's places that you can go to get help.
And that is one of our best sources of referrals because, as we said, a combat vet will talk to a combat vet. Even when they're so isolated, they won't talk to anybody else, sometimes not even their family members.
And there's been some veterans go, I'm not like them, I'm not as bad as that person. That's that comparison thing they'll do.
Unfortunately, a lot of veterans see it as a sign of weakness, and so they think they're not as bad. And then I think what you're referring, though, is some of the veterans who didn't see as heavy a combat, and they think, well, I can't be as bad as them.
Can't be as bad.
Well, as you and I both know, the development of PTSD is an individual experience. It depends on your genetics. It depends on your early life experiences. It depends on how you perceive what's happening to you and what you're being forced to do to others. And so sometimes what seemed to an observer might not be that bad a stress, depending on how the individual interprets it. With hopelessness, with helplessness, with terror, or with incredible empathy for the other person that's being affected, that can cause PTSD from what, again, you or I might consider to be relatively minor. This is a big problem with compensation and pension examiners. If they are not experienced in talking to people with combat-induced PTSD, they don't appreciate this.
Yeah, there's a nuance.
There is, and civilians just don't get it. And unfortunately, we are hiring people from outside the VA who don't have this experience to do these evaluations. And frequently, they're not competent to do them. And I myself I'm an experienced CMP examiner, but the Roseburg facility suddenly decided that they couldn't pay me for doing this work outside of my regular work hours because I'm a salaried employee. Well, I don't know what that's based on. All I know is that my patients and other veterans are suffering because they're not getting their exams from an experienced psychiatrist or other provider. I have objected to it officially, but I'm not getting a response. It's no cheaper for the VA. I don't understand it. It makes no sense at all. I'm willing to do this work, and they don't want me to do it. They'd rather bring in outside contractors, and it's just silly. It's another problem with privatizing what should be government functions.
Well, I think I've read maybe 1,800 comp and pension exams, and it's very fascinating to me. The ones that are excellent are just on the money. They know to ask the nuances of what goes on and tie back. This is clearly agonized this person, even though, and sometimes I go, do they have this idea about it's a war movie? It's not a war movie. It's a person's life.
Right.
And to them, if it's that bad and it's totally screwed their life, it has screwed their life.
Yeah, and not only that, but it's also one of the reasons, and I think one of the main reasons, that the compensation and pension system is so balled up. If they had people like me who really know how to examine them and what to look for, we wouldn't have so many repeat exams, people protesting the decisions, because it's the examiner's opinion that should count the most. And I think you would lump me in with those excellent examiners because I always quote you when I can.
Oh, yeah, so then you must be a wise man. That's funny. Could you continue the issue around how Vietnam has affected society and what actually started happening and how that's snowballed into the 80s, 90s, and 2000s?
Sure. What happened was, as I pointed out in the last show, At that time, families were ripped apart because some people thought the war, we had to finish it continue it till we win. Other people had concluded that we can't possibly win, and which I guess would be a self-fulfilling prophecy, whether it's true or not. But anyway, because of this rift, people started talking about their opinions on the war. And that generalized to people not wanting to talk about politics in general. Now, the people that actually run the country, the powerful interests that are really looking out for themselves, the special interests, took advantage of that. And the political parties began exploiting those divisions to get elected. So they deliberately pitted American against American. And this, you see the situation now. Our political process has broken down. But the topic of this is how it's affected society. When we pick sides in an issue that affects us all and just shut down our minds and don't listen to the other side, then we are no longer participating as citizens in society. And that is only one effect of the Vietnam War. Robert Putnam is I think, Harvard sociologist, probably the most prominent sociologist today in America. And he wrote a book called Bowling Alone, which was a bestseller, and for good reason. He documented with extreme meticulousness the breakdown in what he calls social bridging, which means associations between Americans. The title Bowling Alone refers to the drop-off in bowling league participation, but that's just kind of a prosaic example. Voting registration has dropped off. Membership in VFW and other veterans organizations have dropped off. Membership in fraternal organizations has dropped off, and many of them are at risk of, being wiped out. And that goes on for bridge clubs. Just any kind of social bridging opportunity, they've been falling apart because people are getting more isolated in society, just like the veterans did. And this affected an entire generation because of the almost universal draft, with obviously exceptions. People that were from privileged positions got out of it. And another problem is that people don't understand that the veterans are in the best position to understand the effects of war and to make the decision about whether or not we should go to war. Instead, we've abdicated that, or Congress has abdicated that responsibility, and they go whichever the political wind blows. So when the corporate media beats the drums of war like CNN did, Path to War or whatever they called it, for months ahead of time, they were just setting the stage for the American people to demand the Iraq War, when we've concluded since then that it was a setup and not only not necessary but counterproductive. Because most people agree that going into another country, invading it and occupying it and killing millions of civilians is not the way to fight terrorism. It breeds terrorism. And there's not universal agreement on that, but I think that most Americans understand that now. That's why people in opinion polls are expressing strong opposition to continuing the war in Iraq and also the war in Afghanistan. I know the president has his reasons, and they're logical, but in my opinion, it doesn't pan out. We're not going to leave behind a stable Afghanistan until there's a legitimately elected government. But more importantly, I don't see any way that we're going to overcome the tribalism that's been going on there for thousands of years. They don't want to come together. They want to maintain their little local power bases. And we stepped in the middle of a civil war that's been going on for at least decades, if not hundreds of years.